Hey everyone, picture this. You're at home, cozy in your suburban sanctuary, maybe sipping on a warm mug of coffee, flipping through a well-loved novel, or catching up on the evening news. Suddenly, an invisible vice grips your chest, a tight, crushing pain that steals your breath away. Your heart races, your palms turn clammy, and a cold sweat beads on your forehead, chilling you despite the warmth of the room. In that heart-stopping moment, what would you do? Would panic paralyze you, leaving you helpless? Or could you summon the presence of mind to follow 7 meticulously crafted life-saving steps, each one a lifeline pulling you back from the brink? In the United States, this scenario isn't rare. Every 4 minutes, an elderly American suffers a stroke or heart attack, with about 70% of these cases affecting those over 60 years old. That's over 360 people daily facing this crisis, many unaware of a critical truth. For more than 70% of heart attack victims, there exists a 10 to 15-minute golden window where swift, informed action can mean the difference between survival and tragedy. Yet shockingly, most Americans don't know this window exists or what to do within it. I implore you to listen closely to every word. This knowledge could save your life or that of someone you hold dear. Let's ground this in reality with a story. Last November in Seattle, Washington, 67-year-old John Miller, a retired high school history teacher with a passion for birdwatching, was enjoying a homemade dinner of grilled salmon, roasted asparagus, and garlic mashed potatoes. The rain pattered softly against the windows, a typical Pacific Northwest evening. Suddenly, a searing pain erupted in his chest as if a heavy stone had settled there. Most would have panicked, but John didn't. Months earlier, he had attended a community health fair at his local library where he learned the 7 life-saving steps I'm about to share. Because of that preparation, John is still alive today, cheerfully strolling along the Puget Sound waterfront each morning, binoculars swinging from his neck as he spots bald eagles and great blue herons. So, how did he pull through? First, let's dive into the science behind a heart attack. A heart attack, or myocardial infarction, occurs when a coronary artery, one of the vital pipelines pumping oxygen-rich blood to the heart muscle, becomes suddenly blocked, typically by a blood clot formed around a ruptured plaque. Think of it like a garden hose kinked tightly, halting the flow of water midstream. Without blood, the heart muscle begins to suffocate, starved of the oxygen it needs to keep beating. But here's a crucial fact. The heart is a powerhouse, far tougher than most realize. Even when a major artery is blocked, smaller collateral vessels, tiny backup routes, can pitch in, delivering just enough blood to keep the heart limping along for a short time. This buys you that precious 10 to 15-minute golden window. Within this fleeting period, your actions can halt the damage and save your life. Tragically, many squander this opportunity. Some don't recognize the symptoms, mistaking chest pain for indigestion or arm pain for a pulled muscle. Others know something's wrong but don't know what to do, or worse, they panic and make catastrophic mistakes that accelerate the crisis. Let's bring in another real-life example to drive this home. In Houston, Texas, 72-year-old Mary Johnson, a devoted grandmother of 5 and avid quilter, was elbow-deep in soapy water washing dishes when a sharp burning pain radiated from her left shoulder down her arm, followed by a heavy tightness in her chest as if an elephant were sitting on her. At first, she wondered if she'd overdone it at her morning Zumba class, but the symptoms escalated quickly. Mary had recently watched a public service announcement about heart attack warning signs and the 7 steps I'm sharing today. Her quick thinking saved her life. So, what's the first step to take when a heart attack strikes? It's so simple it might surprise you, but it's non-negotiable. Immediately sit down or lie down. Why is this so critical? Standing forces your heart to work overtime, pumping blood against gravity to every corner of your body. This extra effort can push an already struggling heart past its breaking point. By sitting or lying down, you reduce the heart's workload by over 30%, giving it a fighting chance to keep beating until help arrives. John Miller knew this instinctively. The moment that crushing chest pain hit, he shuffled from his kitchen table to his plush living room couch just 10 feet away. He propped a throw pillow under his head and rested his feet on a low ottoman, elevating them about 8 inches. This single, deliberate action eased the strain on his heart, slowing its frantic demand for oxygen and buying him precious time. A vital caveat: don't lie flat on a hard surface like a tile floor, as this can compress blood vessels and hinder circulation. Instead, use a cushion, folded blanket, or even a rolled-up towel under your head to keep your airway open. If possible, raise your feet slightly to encourage blood flow back to the heart, stabilizing your blood pressure. If you're still watching this video and finding these lessons useful, please comment number 1 below to let me know you're with me. Thank you for your valuable time. But sitting down is just the beginning. The next step is equally urgent. Call 911 immediately. This is where many make a deadly error. Some think, I'll wait a few minutes to see if it passes, hoping it's just heartburn from that spicy taco lunch. Others decide to call a family member first, delaying professional help. Every second you wait, your heart muscle dies a little more. In San Diego, California, 69-year-old Tom Davis, a retired firefighter who prided himself on his toughness, woke up at 1 a.m. with a sharp stabbing pain in his chest. Not wanting to worry his wife and teenage son, he sat on the edge of his bed, clutching his chest, trying to tough it out. 30 agonizing minutes later, the pain was unbearable and he finally dialed 911. Paramedics rushed him to the hospital, where a stent reopened his blocked artery. He survived, but the cardiologist was blunt. Another 30 minutes and you might not have made it. Your heart has lost 20% of its function already. Why is time so critical? Each minute of a heart attack destroys roughly 10% of the affected heart muscle. After 30 minutes, over half could be permanently scarred, impairing your heart's ability to pump blood for the rest of your life. Calling 911 instantly connects you to paramedics who can administer oxygen, medications, or even defibrillation if your heart stops. They'll speed you to a hospital for procedures like angioplasty to clear the blockage. When you call 911, keep your message short and precise. As soon as the operator answers, say, "I'm alone. I think I'm having a heart attack. My chest hurts. I can't breathe well. My address is your street, city, state, zip code." Don't ramble about your medical history or what you ate for dinner, just the essentials. Before calling, check your phone's battery. Plug it in or move near a charger if it's low. Answer the operator's questions about your age, symptoms, current medications, or allergies, and never hang up. Stay on the line following their instructions, which might include staying calm or preparing for their arrival. Another action proven to save thousands is to chew and swallow one 325 milligram aspirin tablet. Aspirin is a blood thinner that can help dissolve the clot blocking your artery, restoring blood flow to the heart. Chewing it allows your body to absorb it in just 5 minutes compared to 30 if you swallow it whole with water. In Chicago, Illinois, 74-year-old Linda Thompson, a retired librarian with a passion for urban gardening, felt a crushing chest pain as she stepped out of her brownstone's front door headed to the Saturday farmers market. She stumbled to a nearby park bench, recognizing the symptoms from a Red Cross CPR course. She called 911 and chewed an aspirin. At the hospital, an electrocardiogram confirmed a heart attack, but her heart damage was minimal. The cardiologist was astonished that the aspirin she chewed reduced the clot's impact dramatically. A critical warning: do not take aspirin if you're allergic to it or have a bleeding disorder like hemophilia, as it could trigger life-threatening internal bleeding. Never borrow someone else's aspirin, as drug interactions can be dangerous. If your doctor approves, carry a small sealed container of aspirin in your wallet or purse. Now, commit to preparing. Your life may depend on it. Next, focus on your breathing. This isn't just about staying calm. It's a scientifically backed technique to ease your heart's burden. Practice slow, deep, diaphragmatic breathing. Inhale through your nose for 4 seconds, feeling your belly expand. Hold for 2 seconds, then exhale through your mouth for 6 seconds, like you're blowing out birthday candles. This method, often used in cardiac rehab, stabilizes your heart rate, lowers blood pressure, and ensures oxygen reaches your brain and heart efficiently. In Miami, Florida, 71-year-old Robert Harris, a former auto mechanic who loved tinkering with vintage cars, was sprawled in his recliner watching a Marlins game when a sudden, intense pressure hit his chest. Sweat soaked his undershirt and his breath grew ragged. He'd read about heart attack protocols in an AARP magazine, so he eased back in his chair, called 911, chewed an aspirin, and began this breathing technique. When paramedics arrived 12 minutes later, his blood pressure and pulse were surprisingly stable. The ER doctor said, "I've never seen a heart attack patient with vitals this steady." That breathing saved your heart from worse damage. If breathing feels labored, don't lie flat. Prop yourself up at a 45-degree angle on a sofa or chair with back support, which opens your chest and eases airflow. Once you've called 911, contact a family member or neighbor. This isn't optional. Even if you think the ambulance is on its way, if you lose consciousness, someone needs to provide your medical history, medications, allergies, or chronic conditions like diabetes or hypertension that doctors require for safe, effective treatment. In Denver, Colorado, 76-year-old Nancy Clark, a widowed retired nurse, was rinsing her dinner plates when a crushing chest pain knocked the wind out of her. Alone in her tidied bungalow, she called 911 and sent a brief text to her daughter Emily, who lived 20 minutes away, "Chest pain, hospital, come now." Emily raced to the ER, where she informed doctors about Nancy's high blood pressure, type 2 diabetes, and daily medications. This information streamlined treatment, and Nancy recovered fully, now enjoying weekly hikes with Emily in the Rockies. Pre-plan your emergency contacts. Program them into your phone's medical ID feature found on most iPhones and Androids. Post a laminated list of contacts, medications, and allergies on your fridge or near your front door. Paramedics often check there. If family lives far away, enlist a trusted neighbor to act as your advocate. Under no circumstances should you drive yourself to the hospital. It's a shockingly common impulse. People think, "I'll get there faster," or "I don't want to make a fuss." This is as dangerous as juggling lit torches during a heart attack. Driving in this state risks losing consciousness at the wheel, endangering your life and others. In Atlanta, Georgia, 68-year-old David Brown, a golf enthusiast and insurance agent, was lining up a putt on the 9th hole at his local course when a sharp chest pain doubled him over. His buddies urged him to rest, but David grabbed his car keys, insisting he could drive to the ER just 15 minutes away. His friend Mike, a volunteer EMT, physically blocked the car door and called 911. Paramedics arrived in 8 minutes, and David survived a major heart attack. The cardiologist later said, "If you'd driven, you could have blacked out on the interstate, causing a pileup. Your friends saved your life." While waiting for the ambulance, unlock your front door and, if possible, any outer gates or fences. Many heart attack patients pass out before paramedics arrive, and a locked door can delay care by 5 to 10 minutes, time your heart can't spare. In Boston, Massachusetts, 71-year-old James Carter, a retired carpenter, felt chest pain after dinner. He called 911, shuffled to his front door to unlock it, and propped it open with a doorstop. 3 minutes later, he collapsed. The open door let paramedics rush in, perform CPR, and use an AED to restart his heart. The ER doctor said that unlocked door shaved off critical minutes. It's why you're here. Clear hallways of clutter, secure pets in another room to prevent barking or jumping, and share lock codes or spare key locations with family or a neighbor. If you live alone, consider a smart lock with a temporary code feature for emergencies. The final and arguably most critical step is to stay conscious at all costs. This sounds daunting, but actively fighting to stay awake can be the deciding factor in your survival. A heart attack reduces blood flow to the brain, raising the risk of fainting, which can trigger cardiac arrest if breathing stops. To keep your brain engaged, use 3 techniques. First, Talk continuously. If someone's with you, chat about anything, the weather, your favorite TV show. If alone, speak out loud to yourself. It's 7:15 p.m. It's Wednesday. The ambulance is coming. My name is your name. This stimulates your brain, keeping it oxygenated. Second, make small movements. Clench and release your fists, wiggle your toes, or tap your fingers. These micro movements boost circulation without overtiring your heart. Third, keep the 911 call active. Paramedics will ask questions. How's your breathing? Is the pain worse? This forces you to stay alert, and their voice anchors you, guiding you through additional steps. In Phoenix, Arizona, 73-year-old Michael Lee, a retired aerospace engineer, was reading a sci-fi novel at midnight when a severe chest pain hit like a sledgehammer to his sternum. He called 911, stayed on the line, and described his condition. "I'm on the couch, breathing's tough, pain's an 8 out of 10. He muttered to himself about the book's plot to stay focused, tapped his fingers, and wiggled his toes. He remained conscious until paramedics arrived, underwent emergency angioplasty, and recovered with no lasting damage. The lead paramedic said, "Keeping that phone line open and talking kept him with us. It was textbook." These 7 steps, sit or lie down, call 911, chew aspirin, breathe deeply, contact family or neighbors, don't drive, and stay conscious, are a proven blueprint, slashing heart attack mortality by over 40%. But survival starts long before the crisis. Prepare now. Program your phone's medical ID with emergency contacts, medications, and allergies. Create a wallet-sized card listing the same and post a copy on your fridge or front door. If your doctor approves, carry a small sealed container of 325 milligram aspirin tablets. Share your home's lock code or spare key location with family or a trusted neighbor, and consider a smart lock for remote access. Build a support network. Chat with neighbors about being your emergency contact if family's far away.